Hi, I'm Steve Podmore, and I'm just going to give you the overview of the vision for Let's Fix the NHS. Really, it's not just about the NHS, it's about fixing healthcare globally and enabling people to have the greatest impact that they can have to that aim. Everyone cares about healthcare. It's one of the most emotive subjects in the world. And that power, that emotive element, if it can be channeled, it can create an incredibly impactful business and it can create real change. That's the goal. So the underlying goal is really about revolutionizing healthcare for a better tomorrow. Doing that in the UK initially, but ultimately worldwide. Now, there are 4 prongs to the vision. First of all is a multi-format media platform, which we'll cover in a bit of detail in a little while. Second is campaigning. That media platform and crowdsourcing ideas and information from a network, from people all over the country and ultimately all over the world, and using that brainpower to help vote on ideas, to vote on proposals, to hold government and NHS leaders to account, that has potential. But when you gamify it, when you have the ability to not just crowdsource the information and the ideas, but put that power of the masses to work and incentivize people for participating and incentivize businesses for sponsoring this vision, it gives them the ability to really have a massive impact all over the world to create real change. So number 1 is the media platform. 2 is campaigning. So from that crowdsourcing of information, crowdsourcing of ideas, we'll be selecting projects to really campaign for. Now, the first is actually going to be the no-brainer thrombectomy campaign, all about taking mechanical thrombectomies from 25% coverage in the United Kingdom to 100%. And if we can do that over the next 5 years, it's got the potential to save over 50,000 lives in the next decade. Now, that's half of them roughly have avoided deaths and half of them avoided permanent and severe disabilities. Now, that conversation with Sanjeev Nayak, one of the first interviews, in fact, the first interview I've done for the platform, brought about the idea for the no-brainer thrombectomy campaign, and that is to get government to ring fence over £500 million over 5 years, 100 million a year, which in the broad scheme of things is very small, with quite a significant project plan initially, and the goal is to raise about £1 million in donor funding to cover that project plan and to cover the campaign. And if we can then get government to ring fence that £500 million for all the elements that can get 100% coverage of mechanical thrombectomy, which is the most effective treatment in the whole of healthcare, 2.5 number needed to treat. So essentially it's very effective and it saves lives. If we can do that, then not only will we be spending £500 million, or the government and the country spending £500 million, over £6 billion of value will be coming back in. And that is avoided healthcare costs, the avoidance of people needing to sell their assets to pay for healthcare, getting young people, because young people have strokes at increasing numbers, getting those young people rapidly back into work and being economically productive for themselves and for their families and for the country. And indeed, this broadly can also bring in incredible revenue for the country by exporting this knowledge and expertise overseas to where stroke is a big issue all over the world. And by doing so, by bringing people in to train them in the UK, this can bring in revenue for the UK. It can provide healthcare professionals before they go back and work in their own countries and in their own healthcare systems. So collectively, that could bring in about 6 billion in revenue and value over that decade. So we call it a no-brainer. So on top of those 2 items, the media platform and the campaign or campaigning, we believe we can build a consulting business to help implement some of those solutions and roll them out. And indeed, the goal is to create an NHS investment bank. That NHS investment bank is all about creating a structure, a public-private partnership structure for a financial institution that can really help unlock risk capital to the most important areas that need it. Now, it's a much broader discussion on how we can do that, but the reality is most investment banks are focused only on financial return. Things that are government only are a little bit constrained by bureaucracy, whereas putting something together which is the best of both means we can really attract the talent, attract the capital, blended capital funds, and deploy those funds in ways that revolutionize early and mid-stage investment for things that are nationally and globally important. So that's the 4 parts of the model. So there we go. We're going to just cover the NHS challenge. So what's the scale of the challenge, the scale of the task ahead? It's huge, absolutely massive. The NHS is brilliant, but it's also challenged. I think we don't need to go into too much detail about those challenges, but the reality is, unless we can get the efficiencies driven, and in fact we can really drive innovation, cut out waste. I don't believe corruption is a massive issue, but I do think competence needs to be really held to account. People need really to be not duplicating and reinventing the wheel. We need to be driving innovation. So that vision really brings together many connected moonshots. It enables people all over the system, all over the NHS, but also patients, external suppliers, people who are in government. The goal is to give them all a voice. Now, what's the business model? Well, the business model is sponsorship, and not just sponsorship from a few connected and central organizations or special interests, although clearly we want to give everyone a shot if they're adding value. But we also want to be independent sufficiently so we can call out organizations that are profiteering but not delivering sufficient and commensurate value. So one of the problems with sponsorship is if you rely on too few and too large sponsors, that presents a problem. Whereas our business model is to enable businesses of all sizes the opportunity to align their business with the values that they and their employees and their customers aspire to having. And for a small monthly or quarterly amount of money, the goal is to generate sponsorship revenue with sales teams and with marketing to those sponsors. And that will in turn fund the content aspects of this business. And doing it in the right way with regular repeat income, we believe that can generate over a 3-year period a sponsor budget of upwards of £20 million. And that means we can be creating a lot of events, a lot of podcasts. We can bring together content that already exists to make it more accessible without essentially overriding the existing providers of that content. We can essentially provide a portal, but also create a lot more content that makes this business ideas, proposals, waste, and really absurd things that occur. We can bring it out into the open and give people regular bite-sized chunks in many forms. So the content will suit people's needs. It doesn't have to be hours and hours. It can be bite-sized chunks. It will be on social media, and it will be excessively and extensively promoted, including by the subscribers and the sponsors. So by creating that movement, it really gives us the ability to generate reach and to give people hope. At the end of the day, this business is all about hope. And hope is about believing not just your efforts, but those who are working in alignment with yourself can actually bring about the change that you or the people that you care about need. And in the NHS, I don't think there's anything that could be more relevant. My own journey is that my mother had a stroke in 2023. She had 4 months in hospital. She was able to come home for 10 months, although she couldn't speak. She could only walk a few steps, but she was still in there. And I had the privilege of being able to look after her for that 10-month period. And then sadly, she had a second stroke and then passed away last year in August. But that and the passing of an illness of my brother a couple of years earlier, and indeed my father back in 1999, has given me plenty of interfaces with the NHS, along with my own health challenges occasionally. But I can only speak highly for the organisation and for the people within it. But equally, I can recognise many of the challenges and flaws. So I believe people power, and hopefully you believe too, can play a massive role in creating the change we need. So that investment is really about funding and financing the future of healthcare. And by creating the platform with the media platform, the consulting and the campaigning, over time, we can create the power and the strength and the public profile necessary to get out of the gate a well-designed, intelligent NHS investment bank. And that's really what we believe is the four prongs that can deliver something significant for people around the world and in the UK. So where are we funding-wise? Well, to launch this, we've created some base content. We've got a couple of interviews out there and more in the pipeline. I'm recruiting personnel and the team, but the goal really is to raise $1 million of equity to fund that initial content development so that we can get enough content out there to then attract the right sponsors. Of course, we're interested in attracting pioneer sponsors right from the get-go, but this has to be properly funded. So we're raising equity, but we're also raising donor funding to fund the no-brainer thrombectomy campaign, as I said a few moments ago. So future rounds. Well, although we're raising initial £1 million of investment, the model and the business plan and the financials show that this has got the ability to really scale in this country and to scale around the world. So the goal is to then raise another $2.5 million and then another 10 million, potentially further rounds to scale this incredible platform. And the business sponsor and individual sponsor and crowdsourcing model means it can generate decent investment returns as well as really significant impact. So if you are a qualified investor, if you are responsible for investment from a potential partner organization, a corporate venturing partner, then I do encourage you to get in touch. Going back just quickly to the NHS Investment Bank, the goal there, and again, on top, 13.5 million is nowhere near enough to launch the investment bank. So that will be a separate thing. There will be some shared ownership, but the structure for the investment bank is to raise quite a significant amount for the bank itself, as well as then the funding into the funds that bank will manage. It will both do transactions and earn advisory fees for those transactions, but it will also raise and manage its own blended capital, permanent capital, high impact investment fund. And the goal of that fund is to do early, mid and late stage investments all in one structure. It has to be quite sizable. So we're talking many billions. Just a few 100 million is nowhere near enough. So it is a very bold vision. But through the blended capital model, underwritten potentially by, or portions underwritten by philanthropy and governments, it means we can crowd in a great deal of institutional investment for lower risk. And that means the overall capital cost can be affordable, and it doesn't need to make private equity style returns for it to work out for the investors, but also for those that we're investing into. So that's a little technical, but for those who are finance focused, hopefully that gives you some insight into the vision for that investment bank. So think tanks, in a way, the business becomes an independent think tank, but we're not reinventing the wheel. There are many entities out there, the King's Fund, there are the Royal College of General Practitioners, the Royal College of Surgeons, the number of health-related organizations is massive. And what we want to do is showcase them and showcase their work, as well as showcase the healthcare and health tech innovators in this country and beyond. But we also want to not just showcase them as an advert. We want to essentially really hold them to account, dig into their business models, dig into what it is that they're doing. Of course, promote, but not promote blindly. That's the key. So this sort of hybrid think tank means we'll be able to challenge the ideas of other institutions. And when there's been reports that are written about healthcare reform or innovation, and where those ideas have not passed muster and become the norm, become implemented, we want to find out why. We want to discuss, and that's part of what we'll be doing with the media platform. So talent. Of course, we want innovators, we want media, we want production personnel, we want people who can speak to camera, who can interview, as well as those who have great understanding of the NHS. And then separately, those who have the ability to sell and generate sponsor-related revenue. And of course, this is about getting an audience. So we need social media, we need YouTube experts, we need a large number of people. If that's you, don't hesitate to get in touch. So my background, I think I said I have worked on a big idea called Transform Global for a long time, all about creating alternative models of finance to fund the Sustainable Development Goals. When my brother passed away, I had to look after my mum, and then with my mother's stroke, I had to put essentially my life and my projects on hold. And the vision for Let's Fix the NHS is something that literally I was sitting next to my mother as she was in her last days and weeks, and it just came together. It came, and I do want to create a legacy for my mother, for sure. Rena Podmore, who was the most amazing human being, and separately I'll tell her story. But actually, what I want to do is to create something that essentially thanks everyone who was able to support us in the NHS, but who needs that voice, individually or with other people who speak on their behalf. We want to make sure that the reforms that are necessary create an NHS and enable this amazing organization to last for another 75 years and beyond. So I'm just going to give a little bit of a recap, a visual recap of the model. So as we said before, it's a multi-format media platform. And as we can see, business will sponsor anywhere from £20 a month to many thousands of pounds a month, depending on the size of the organization. And in some cases, millions of pounds a year. That's what we want. We do want 10 cornerstone, £1.2 million, so 100,000 a month cornerstone sponsors, but they will not be the only entities. We want many, many thousands of organizations to spread the load and to create a movement. Individuals can subscribe for free, but they can also participate and vote for ideas. And if they're voting for those ideas and contributing those ideas, then indeed they can participate. I'll show you in a moment how. But all of those businesses and all of those individuals, the goal is to get them to co-promote the business model. So they would be able to have a sticker in their car or their car window or their home window or on their Facebook profile, The businesses would be able to just imagine a coffee chain, for example, that every coffee shop has a sticker and leaflets that people can take away so they can figure out how they can contribute their ideas and their brain power to help fix the NHS. Not just coffee chains, but all manner of businesses. That's what we want to do, to make sure people are contributing financially to that, which is benefiting their employees and benefiting their customers, but they also benefiting their network and their reach. We want to create a massive movement. And those ideas and suggestions that are contributed, whether that is through the clinicians, the nurses, the healthcare assistants, who, these people have got the knowledge, they're at the coalface. And that's what our goal is to unlock that incredible power and channel it intelligently. And for doing so, we are going to take some of the revenue generated and generate awards and prizes. So people will have an app, or businesses will have an app, and they're able to get recognition, and they're able to get meaning, but they're also able to get meaningful awards and prizes so that they can potentially go to events, have things that actually are not necessarily monetary value massive, but they show recognition, and having a leaderboard. So by doing that, the goal is to create quite a significant content budget. The revenue model means about 25 million if we are able to hit our targets, adding a couple of salespeople a month for a couple of years. And then by the end of the third year, in total, that would have created, with fairly modest sales targets, a £25 million content budget, as well as the money for the technology and marketing and other aspects of our business model. Now, it's a profit with purpose business, but it's designed to take a portion of those profits and put them into the campaigning effort and put them into the high impact activity that we're going to deliver. So what's the content? So with independent journalism supporting it, there will be news programs, in person, virtual and hybrid events. There will be interviews and in-depth podcasts. Of course, we will also be bringing other content that's already out there into focus. So we will be reporting on it and commenting on it. We'll be having panel discussions where there's aligned collaboration. That will include existing institutions or NHS organizations. News and documentaries, so people will be able very easily to get a 10-minute roundup or update every day, or indeed in-depth news or documentary style programming. Of course, social media, we will take all of the content and slice it and dice it, so all of the platforms have content, and of course YouTube, and ultimately broadcast television. So engagement and activation, what's the strategy? Well, in very simple terms, we want to find absurdity and showcase it and call it out. We want to champion and model excellence. And that includes health tech and innovators and showcase what they're doing within the NHS. So if we go back to thrombectomy, for example, the AI that supports the expansion of thrombectomy services to more patients, because with better understanding of scans, that is better with AI to augment what the neurointerventional radiologists and other experts can do on their own. That means this incredible technology is having real world application and saving lives. So we'll be digging into that. Another example is the stents that are used for the mechanical thrombectomy, and how those technologies are improving, and how they're enabling incredible radiologists or neurointerventional radiologists like Sanjeev Nayak and his team to essentially go into not just the major vessels, but the smaller and medium vessels, so more patients can essentially avoid disability and death. So these kind of technologies, but right the way through healthcare, including care-related innovations, and the best, we'll be showcasing the very best of care and calling out organizations that are, going back to showcasing absurdity, that are falling short. This is the goal, to bring this information to everybody, but in an accessible format. And ultimately, we want to get stuff done. So the reality is there's an awful lot to do. And the NHS, can it be fixed? That's a huge question. But should we lay down and just hope? I don't think that's the strategy. The strategy is to get these discussions and these systemic discussions out into the open. When I say systemic or system level, it really means, a linear solution is something that has one aspect to it. And often when you're talking about discharge rates, for example, at hospitals, where it's said up to a third of hospital beds are where people are not having NHS services in the community, they don't have a bed available for them to go in their home or in care, and therefore they're staying in hospital, holding up beds for far longer than they should be. And unless we can tackle this, which means many stakeholders need to be involved and have those open and honest discussions and hear out the solutions that people have, unless we can do that, we're not going to solve these things. And that's the thing that I believe has been missing. So those businesses that we talked about that can be built on top, well, this media platform, independent, essentially NHS TV, independent, sponsored media organization that can create a massive amount of high quality content. We believe it's possible to build on top of that the consulting business, the campaigning entity, where we will be campaigning for the likes of the no-brainer thrombectomy campaign, and indeed the investment model, the NHS investment bank, if that is an appropriate name when we come to actually do it. But this model, this vision for transforming the NHS, it is definitely collaborative with the government of the day and with the professionals, with the civil servants and the 1.5 million or so NHS staff. But just to be clear, the name Let's Fix the NHS, it's as much about reducing burden on the NHS, for example, solving the discharge problem or helping to do that, and many, many hundreds or thousands of related challenges. If we can reduce the burden, as Wes Streeting and previous health and social care ministers and prime ministers have done before them, in their 3 shifts, which is moving from analog to digital services where possible. And in the age of AI, that is so much more appropriate, but it's no small task to do so. So shift 1 is analog to digital. Shift 2 is moving from cure to prevention. And shift 3 is in hospital to in treatment in the community. So if we can do that, we reduce the burden on the NHS. Now, as Sir David Haslam mentioned in my interview with him, to do that, we have to really switch as well and really evaluate the investment models. And particularly, we need to switch investment to primary care and to care in the community. So are we really analysing how that can be done? Are the investors and capital providers, as well as those who allocate capital from within the NHS, are they taking that seriously? Well, I'm not so sure. But that's the model. Now, what are the outputs? Well, the goal is to save lives. Now, if we just implement the no-brainer thrombectomy campaign and help, and it's not that we'll be doing this on our own, just to be clear, there are many stakeholders that need to be brought together that are working in these ways already, including the Stroke Association, including different strokes. There are many organizations, but to get from 25 to 100% thrombectomy coverage, we need to look at transport and transfer, so paramedics, air ambulances, and potentially, as soon as they are able, electric vertical takeoff and landing, so modern and future aviation suppliers. There's so many actors that need to be brought together. And if we're able to do that and help convene that, then just that no-brainer thrombectomy campaign alone could save those 50,000 lives. But if we can do that in just one area, what if we could do it in dozens and dozens of areas? What could be achieved? So we want to improve lives, and clearly, if we avoid avoid stroke through prevention, and I'm only talking stroke. There's so many other issues, obviously heart and oncology. I mean, I don't need to go into all the issues now, but if we can save lives, if we can improve lives and give hope, then that means we can also have fun and enjoy the process, holding government and NHS leaders to account and creating a massive movement for positive change. So if we do that, we create a think, a do, an inspire tank. And what we do is create feedback loops, a flywheel effect. So ultimately we can create potentially the largest social impact movement ever created. We can replicate this platform all over the world. And that is what the vision for Let's Fix the NHS is about. So action, what can you do to join this revolution? Well, you could like this video. You could share this video. You could actually email the link to people that you think should see this video, and you should get in touch. You can email me directly, steve@letsfixthenhs.help, or catch me on LinkedIn or any of the platforms. You can take a look at the existing content. And if you're interested in the investment or the employment partner opportunity, just get in touch. So thanks a lot for watching. These are where we are on our Substack, the LinkedIn, YouTube, Instagram, and the basic website. So thank you very much. And I look forward to fixing the NHS with your amazing help. Many thanks.